Speaking of Ebola, we now have a second case that has been transmitted in this country, but from the same essentially scenario. Another nurse at that hospital in Dallas contracted Ebola from that patient who was a Liberian national. Apparently, this nurse, and it's quite clear that the protocols that were being followed at this hospital were not up to snuff. And I would hope at this point, hospitals around the country are taking this a little more seriously in terms of their protocols. But this healthcare worker who tested positive for the Ebola virus, and you should know at this point, 77 people are being monitored at the Dallas hospital. 2 now have tested positive. I believe there are another 48 who are being monitored who are in contact with Eric Duncan, Thomas Eric Duncan, the first victim. This healthcare worker who tested positive for Ebola took an airline flight from Cleveland to Dallas-Fort Worth International Airport the day before she reported symptoms of the virus. Oh my God. Now, generally speaking, to the extent that we know, you are not infectious if you are not experiencing symptoms. But who knows, whether or not she was feeling symptoms as she flew back. The Center for Disease Control and Prevention said in a statement that because of the proximity and time between the evening flight and first report of illness the following morning, the agency was reaching out to passengers of that flight. There's 132 passengers who took that Frontier Airlines flight from Cleveland to Dallas have been asked to contact federal health authorities. So they're not necessarily in touch. I imagine she was also around some other people in Cleveland. So at one point, this will be containable. But we're clearly not up to snuff. And it's quite clear that the idea that we can cut things like the NIH and emergency preparedness and have it have no impact is all well and good until it has impact.